we are the team behind the newsletter. We're leading the Health 2.0 Egypt chapter, and we have these discussions, and we wanted to share this one with you, where I'm posing to my two counterparts in the argument today that digital therapeutics is a really exciting opportunity for the Middle East and Egypt. And really quickly to define it, digital therapeutics is a space where it's bringing the best of telehealth, remote monitoring, and data analytics in a clinically validated way. So we see a lot of companies like Big Health, like Omada, like Livongo before, that really bring in all these tools and allow the FDA to approve the clinical trials based on these interventions. So we're seeing, I believe that it's a really, it's the frontier that comes naturally next in digital health, where we have FDA approved therapeutics. So like software that acts like medicine. And the reason why I think it's important is because we have a large number of chronic disease patients in the Middle East. We have good research facilities that we can use, provided there's funding for these projects that come out of it. So there's the need, there's the option to do it. And there's a lot of innovation already when it comes to remote monitoring and telehealth. So why don't we put all those together and solve diabetes in the Middle East, or solve hypertension in the Middle East, or solve Alzheimer's in the Middle East? And that's what I pose to you guys. So I'm favorable of digital therapeutics being something that we need to work on now. Yoro, let's start with you. What do you think about this argument?
Well, I really like digital therapeutics, and I think it is mostly the future of how are we going to change healthcare. And I think you, Omar, being an optimist as you are, you think we can actually do it in the Middle East right now, always being an optimist and pushing boundaries. بس I think برضو ان في challenges كتيرة جدا ان احنا نعمل digital therapeutics او ان احنا نفكر في digital therapeutics دلوقتي في الميدل ايست، لان we need to start from the basis of digital health، ان احنا يبقى عندنا electronic medical records, personal records, databases فيها ال information والdata اللي نقدر بعد كده we can put on top of it digital medicine or things that improve the clinical process, and then we can use digital therapeutics. But I think it kind of maybe goes in this direction. Ideally we'd hope to reach there soon. بس من أكتر المشاكل اللي بنشوفها في الميدل إيست هو إن there is a massive focus على الحاجات ال direct to consumer، الحاجات ال on demand لل patients directly، علشان في resistance جامد جدا من الدكاترة ان هم يغيروا الكلينيكال ورك فلو شكله عامل ازاي. والdigital therapeutics is basically changing the clinical workflows of the doctor. So maybe phasing it out, I think that's for now, and I hope it's accelerated.
عمر زكي، أتمنى تكون أنت معايا and also an optimist since you're calling in from one of the most
Texas.
innovative cities in the US.
yeah, isn't it cool that we're talking about healthcare in Egypt and 3 different countries represented, Lati? So being here in Austin, obviously we're talking طبعا about a lot of innovation and a lot of kind of bold cutting edge disruption to the industry of healthcare using the technologies اللي موجودة and all of the digital transformation. And I think to your point, I'm برضو very much pro and bullish digital therapeutics. It's like we've discussed before, to me, kind of like telehealth was, 15 years ago, maybe 10, 15 years ago, where it's a necessary and it's going to be there and it's going to be an integral part of healthcare delivery, but it's still in that early kind of discovery stage where there's a lot of rule making and kind of role playing or role decisions and kind of determinations and complexities because of the different players, that are involved, pharma, biotech, government, being able to get evidence-based digital therapeutics means you have to go through trials, you have to recruit candidates, you have to have sponsors, but those things take time, right? And to get to even an ability where they're deployed, kind of on a wide scale, like Yara said, you have infrastructure challenges. But I think it's something we need to keep talking about. I think it's something we need to keep addressing. Well, I think markets like Egypt present the opportunity of being a actual like a piloting market, a place where we can do these trials and we can work with the governments, the sponsors, the private sector to, actually deploy on some, relative reasonable scales the ability to validate these digital therapeutics and see how they may solve real challenges in a market like Egypt. So yeah, I'm very supportive that we keep kind of talking about it and keep looking for ways to, test it out and see how it can work.
But I think I can pose another counter argument on exactly what I said before. The main idea of digital health thinking about leapfrogging and how like the developing countries can use all the experience from the more developed countries to leapfrog this part where they had lots of challenges. But I'm honestly struggling to think how can that happen in digital therapeutics. So both of you guys. عمر
Yeah,
شاكر
it's a great point. يعني the ability to leapfrog means you have to have برضو some sort of creative thinking around deploying that solution, right? So I mean, I'm sure that idea exists. I'm sure those solutions do exist. احنا برضو من ناحيتنا هنا في Austin trying to help promote and support the ecosystem in a market like Egypt. We want to create more opportunities for those ideas and those solutions to be available. How can we برضو look at solving these problems and figuring out how to leapfrog the existing infrastructure challenges, our bureaucracy challenges, our system challenges, so that these therapeutics actually start working. And there's some people talking about it now, how to scale a digital therapeutic, how to scale deployment of digital health technologies and capabilities, especially in markets that may traditionally not be as well connected or as developed in terms of the infrastructure for technology and wearables and devices and these kinds of things.
And عمر شاكر ايه رأيك? Do you think we can leapfrog?
I totally believe that. I think if you look at the Digital Therapeutic Alliance map and where they're active in places around the world, we wouldn't find any in the Middle East or Africa, but we'd see some, not necessarily all of them, in like super advanced countries, برضو. And I think when we look at electronic medical record, just because this is a point that you both brought up in terms of infrastructure, I also don't think that it will require us مش لازم ناخد نفس الوقت ونعمل نفس الغلطات اللي امريكا واوروبا عملوها عشان امريكا واوروبا عندهم الانفراستراكشر ده بس هو مش شغال. So we need to be aware of that. And هو I had a whole career of just fixing electronic medical records and clinical data, and it's still not fixed. But that's why we're partnering now with and in talks with AHIMA, which has seen that whole story in terms of health information systems, to bring some of their expertise and help people in the region that are still installing these systems from the beginning. I hope that innovation kind of plays a role in أنا لو أمريكا وأوروبا هيبقى عندهم digital therapeutics في خلال 5 أو 10 سنين الجايين, which I know it's still very early even in the States and even in Europe, and we're still figuring out what does it even mean to do a digital therapeutic and to approve a drug and who are the stakeholders والحاجات دي كلها. All that needs to be figured out, but I feel like why can't we figure it out as they figure it out, That's always going to be my position, but I concede to lose this one, and I'm
Don't
really
lose.
excited.
No, you didn't lose.
You didn't lose. I hesitated. I hesitated 5 minutes into the conversation.
Well,
Yara always, gives us the realistic perspective.
Okay, but in order for people to stay engaged with this, we do have to have an official winner or loser kind of end to this. So after this conversation, is it the right time to talk about digital therapeutics in the Middle East or not? I still hold my position, yes. What about you guys?
I agree, yes.
You agree, yes? Okay.
Yes.
I would say no, but I would say also if any of you guys watching this video who is working in digital therapeutics, reach out to us and tell us what are you working on, what are you interested in, and we'd love to know.
Agreed.
Okay, what topic should we talk about next time, guys?
Oh man, there's so many good ones.
Who wants to choose one? Yeah, I know.
I think investment.
investments. It's a
The
very
new healthcare
timely.
investments coming into Egypt. Yeah, let's talk about
Yeah.
that.
There's a lot of them. Okay.
A
Yeah.
lot of
Cool.
money is coming in, and we want to talk about who should take that money. هنعمل ايه
Where it's
بالفلوس
going.
ديت. Yep.
Us, Health 2.0 needs to take that money, of course.
Yes.
Give us
Yeah.
some. Give us
Health
some.
tech.
But
Health
yes,
innovation.
health tech. Awesome. So our next edition is going to be May 15th, and we're going to come back with us putting on our investor hats and thinking together about where all this money that's coming into Egypt and the region should go towards in terms of health tech in the Middle East and Africa. Thank you, Alma, and thank you, Yora. And thanks to everyone watching.
Hi.
Talk
See you in
soon.
2
Have a good
weeks.
day. Bye.